Dr. Alana. Who do I have the pleasure with?
Jimena de la
Jimena de Lago. Okay, is there any way you would like me to address you?
No, Jimena is fine.
Jimena is fine. Okay, how old are you, Jimena?
50.
You're 50. Okay, and I'm going to ask you a few questions, then we're going to move on to your physical examination. Can you tell me the reason of your visit today?
Oh yeah, I have some knee pain.
Okay, knee pain. How would you describe this pain? Is it like a stabbing-like sensation, like some numbness, or
I would say some like pressure.
pressure? Okay, and if you were to rate this pain from a scale from 0 to 10, what number would it be?
I would say 4.
A 4. Okay, and when did this pain begin?
Last week.
Last week. And has this pain been constant, or does it come and go, or does it appear in any specific, when you're performing any specific activity?
Yeah, when I'm after doing physical activity.
After doing physical activity? Okay, have you tried anything to relieve the pain?
No.
No? Have you noticed that aside from working out, any factor has triggered or worsened the pain?
I would say performing physical activity.
Only performing physical activities. Okay, other symptoms that I should be aware of?
No.
Does this pain usually spread to another part of your leg, or does it only stay on your knee?
Only in my knee.
Okay, then I'm going to ask you a few more questions for me to know about your clinical history. Would that be fine? Okay, so have you ever experienced any trauma or injury that could lead to a surgery or being hospitalized?
No.
So no surgeries, no hospitalizations. Okay, then what is your current occupation?
I'm a secretary.
You're a secretary. Okay, and does your work usually require for you to stay in the same position all the time?
Yeah.
Okay, how much time do you usually stay in that position?
For around 6 hours.
For around 6 hours. Okay, have you ever done any workout or sport before?
No, never.
No. Okay, then do you perhaps know if you suffer any significant illness such as arthritis or osteoporosis?
No.
No? Okay, do you know if anyone in your family, your close family members, have any hereditary disease such as scoliosis, for example?
No.
No. Okay, and then we are done with the questions. We're going to start with some physical examinations. I will be assessing some specific regions such as your shoulder, your knee, and your hip because of your age, and also because you have mentioned that you wanted to start practicing more exercises. Okay. So first, I would like to move on to your shoulder. Would that be fine with you?
Yes.
I will be in close contact with you. Okay. So first, I will be inspecting it. Okay. So I will be moving your hair. Okay. I don't see any bruises. I don't see any scars, any tattoos. I don't see any swelling. Everything seems normal on your right shoulder. I will be moving on to your left one. In the same way, I don't see any wound, any scars, any tattoos. And if I'm going to assess you from in front of you, I see symmetry. I don't see any muscular dystrophy, so everything seems fine. Now I will be moving on to palpation. Would that be fine with you?
Yeah.
Tell me if you ever feel any pain. Okay. So first, I will be assessing your clavicle. It doesn't hurt.
No.
Okay. Now I will be moving on to your acroclavicular joint. The head of the humerus. Okay. Now your deltoid muscle. It doesn't seem swollen. Does it hurt in any moment? No. And then your posterior shoulder. Okay. The scapula. The spine of the scapula seems fine. Okay. Does it hurt in any moment when I palpate?
No.
No. Okay. Then I will be moving on to your left one. The same way. I will be assessing the clavicle. No. Acromioclavicular joint. Okay. The head of the humerus. No. Deltoid muscles. And moving back to your scapula. Okay. Then Jimena, I would like you to perform some activities. It's just some movements. I will be helping you in some, and then I will need you to do some on your own. Would that be fine with you? Yeah. Okay, first I will need you to try to raise your arms as long as you can. Okay? Does it hurt in any moment? Okay, can you lower them? Okay, then could you move them towards the back? All the way as you can, straight, okay? Then you can put them once again on your knees, it's okay? Now I will be assessing rotation, okay? Please put your hands on your head, okay? And let's do some external rotation first. Try to move them to the back. Does it hurt in any moment?
No.
Okay, once again, you can put them down. Now I will be assessing internal rotation. For this, I will need you to put your hand on your back. The palm will be facing behind you. And then I will need you to try to raise your arm as high as you can on your spine. Does it hurt?
No.
No? Okay, then let's do it on your with your other arm. What about now? Any pain?
No.
No. Okay, then you can lower them. We are going to perform some of the exercises you just did, but I will be helping you in this case. Okay? So first, you can put your arms straight. And does it hurt? No?
No.
Okay, so let's lower it. Now, let's do it this way. Does it hurt in any moment? No?
No.
Okay, and then we can put it down. And once again, in your other arm. Straight, straight. Okay, does it hurt?
No.
No? Okay, let's lower it. And then, okay. a 90-degree angle and try to move it like a 30-degree angle to your right in this case. Okay. Now internally rotate your arm till your thumb is looking down. Okay. I will be applying pressure and just try to resist. Okay. Okay. Negative signs. Then let's move on to the other one the same way. Raise it. Let's move it externally. Rotate your arm and pressure once again. Does it hurt in any moment? No? Okay. Then let's assess your hips and knee. First, I will need you to stand up. Okay? First, I will be assessing any symmetry or any specific factor I could see. Okay, both knees seem symmetrical. I don't see any scars, which could indicate previous surgeries. I don't see that they are swollen. Just I see some rashes and skin discoloration on your right knee. For your hips, could you turn around, please? Okay. Like this. Okay, I see symmetry. I don't see discoloration. Does it hurt you to be standing up in any moment? No. Okay, can you look at me once again and walk towards me? Okay. Then turn around and walk all the way over there. Okay. Okay, I see a normal walking pattern. Does it hurt in any moment? No. Okay, please could you lay down? Okay. Now I will be assessing first your hips. I will be, since we already inspect, we are going to move on to palpation. You can lower your knees, please. First, I will be finding the iliac crest. Okay. So once I found it, I will move to the head of the humerus and the greater trochanter of the humerus. Does it hurt in any way? Okay. The inguinal canal. Does it hurt? No. The same in the other way. Okay. So the iliac crest, the inguinal canal, the head of the humerus, and the greater trochanter. Okay. Since we already have your knees here, so we are also going to assess your knees. I first will be palpating the patella. Does it hurt in any moment? I am touching your right leg, the one you mentioned. Okay? No pain.
No.
Now, the left one. Does it hurt? Okay. Now I will be assessing your lateral median. Does it hurt?
No.
No? In this one? No? Okay. I will be creating some small pressure for me to assess if the patella is swollen. Okay? I will be applying pressure and using the tip of my fingers, I will be pressing the patella. Does it hurt? No. Okay. Once again. I don't notice any liquid accumulated in it. And then I will be moving on towards some normal movements for your hips. First, I will ask you to flex. So let's keep the leg straight and I'm going to elevate it. Please tell me when you can no longer continue lifting your leg. Okay? Does it hurt in this moment? No? Okay, let's raise it a little bit more. No? Okay, then we can lower it and once again in the other leg. Extension. Then I will be assessing your abduction. Once again, the straight leg. And I will be moving your leg. Does it hurt?
No.
No? Then abduction all the way over here. Does it hurt? No? Then once again on the other leg. Okay. And then here. So no pain then. Okay, I will need you to lay on your belly. And let's do some extension. Does it hurt?
No.
No? Okay. And the other leg. Does it hurt?
No.
Okay. I will be assessing now using the Thomas test. Please sit on the edge of the bed. Okay. Since you mentioned that the knee that is hurting is the right one, we are going to use the other leg, which is normal for the test. Lay all the way back. Okay. And I will ask you to please bend your left knee all the way that you can. Okay? Does it hurt?
No.
No. Okay. Since your other leg, the one that is injured, you didn't move it, it could lead to a negative result, which would lead us to the conclusion that you do not have any problem with your hip. But we can also assess the other side, just in case. Once again, same process. Lift your arm. Okay, and lower it, please. Does it hurt in any moment?
No.
Okay. You can see again, please. So we already inspect your knee and we have done the palpation at the same time. Then we are going to move on to some exercise, some passive and some active ones. Okay, so once again, lay please, lay down, looking upwards, and straighten your knees. Does it hurt in any moment when you straighten your knees? No? Okay, then let's bend only your knee. So try to do this. Does it hurt?
No.
No? Okay, let's lower it. And the same way the other leg. Does it hurt?
No.
Okay, lower it. Then I would like to assess the things, which would be the anterior and posterior drawer test. I will ask you first to bend whichever knee you would like. Bend one, please. Okay. Let's move your left side like this. I am going to put my hands behind your knee and create some push and pull.